Disease of the heart muscle. Histology. Study of tissues. Bilateral. Present on two sides. Tachycardia. Fast heart rate. Bradycardia. Slow heart rate. Unilateral. Pertaining to one side. Abdominal. Stomach. Abdominoplasty. Surgical repair of the abdomen. Endocarditis. Inflammation of the inner lining of the heart. Chondromala. Softening of cartilage. Arthrodesis. Surgical fusion of a joint. Spondylolisthesis. Forward slipping of a lumbar vertebra. Myasthenia. Descending muscle weakness. RA. Rheumatoid arthritis. DTR. Deep tendon reflex. Integumentary system. Skin. Bactericidal. Kills bacteria. Subcutaneous. Pertaining to under the skin. Dermatitis. Inflammation of the skin. Mohs surgery. Microscopically controlled surgery where growth is removed and examined. IND. Incise and drain. SUBQ. Subcutaneous. Pulmonary veins. Six-pack into the carry the oxygenated blood from the lungs into the left atrium of the heart. K. Alveoli. Terminal air sacs that constitute the gas exchange surface of the lungs. Orthopnea. Ability to breathe only in an upright position. Pneumonia. Inflammation of the lungs. Sinusitis. Inflammation of the sinuses. Spirometry. A measurement of breathing. URI. Upper respiratory infection. SOB. Shortness of breath. COPD. Chronic obstructive pulmonary disease. Esophagus. A muscular tube that connects the mouth to the stomach. Duodenum. First part of the small intestine. Diverticulosis. Abnormal outpouchings in the intestinal wall of the colon. Jejunostomy. Surgically created opening into small intestine through abdominal wall. Dyspepsia. Poor digestion. Esophagogastroduodenoscopy. Visual examination of the esophagus, stomach, and duodenum. Anatomical position. The reference position for all directional terms. Cellular level. The smallest living unit of structure. Physiology. The study of how the body functions. Anatomy. The word derived from two word parts that mean cutting apart. What term means opposite of medial? Lateral. Frontal section. A cut dividing the body into anterior and posterior portions. Transverse section.
According to Wikipedia.
A cut dividing the body into upper and lower portions. Sagittal section. A cut dividing the body into right and left portions. In a dehydration synthesis reaction, water is what? A product. How much pH does an acid have? Less than 7. What makes up an atom? Proton, neutron, electron. The atomic number of an atom is equal to the number of what? Protons. Atomic mass of an atom is equal to what? The number of neutrons and protons. Characteristic of a neutron. Contributes to the atom's atomic mass, is located in the nucleus of the atom, has no electrical charge. The plasma membrane of a cell is composed of what? Phospholipid molecules, cholesterol molecules, protein molecules. What acts like an identification tag for the cell? This is an important function of the cell membrane. Osmosis. The diffusion of water through a selectively permeable membrane. Dialysis. The diffusion of solutes through a selectively permeable membrane. Pinocytosis. The process used by the cell membrane to actively take in fluids and dissolved substances. Filtration. The process that uses hydrostatic pressure to move water and solutes through a membrane. Phagocytosis. The process that actively traps solids in the cell membrane and brings them into the cell. Metaphase. Chromosomes align themselves in the center of the cell during this phase. Telophase. Chromosomes form chromatin and the nuclear envelope reforms during this phase. Interphase. The DNA replicates itself during this phase. Anaphase. Chromosomes are pulled by spindle fibers to opposite sides of the cell during this phase. Prophase. Chromatin becomes organized into chromosomes during this phase. Nervous tissue. Is the tissue connected and supported by glia cells? What is the ideal body fat percentage is considered to be? 12% to 18% for men and 18% to 24% for women. Epithelial tissue. Is simple columnar tissue. Example of muscle tissue. Cardiac tissue. Example of connective tissue. Bone tissue. Define a system. A group of organs working together to perform a function. The integumentary system includes skin, higher specialized sense organs. How many bones make up the skeletal system? 206. What is another name for the glands in the endocrine system? Ductless glands. The main function of the respiratory system, the exchange of oxygen and carbon dioxide, occurs where? Alveoli. Stratum corneum. The outermost layer of the epidermis. Dermal papillae. The part of the skin that gives you a unique set of fingerprints. Erector pili. The small muscle attached to the hair. Sebaceous glands. The glands of skin that produce oil that lubricates the hair and skin. Second-degree burn. A burn involving both the epidermis and the upper layers of the dermis. Epiphysis. The end of long bones. Trabeculae. Needle-like threads of spongy bone. Osteoblasts. The bone-forming cells. Another name for chondrocytes is what? Cartilage cells. Maxilla. Is the upper jaw bone. Intercalated discs are found where? Cardiac muscle. What's another name for smooth muscle? Visceral muscle. Another name for skeletal muscle is what? Voluntary muscle. Insertion. the muscle attachment to the more movable bone. Actin. The thin myofilament of the skeletal muscles is made of this. Dorsiflexion. The term that refers to ankle and foot movement. Peripheral and central. The two principal divisions that make up the nervous system. Neurons and glia cells. The two principal divisions that make up the nervous system. Astrocytes. Cells that are important in the blood-brain barrier. Reflexes can be how many neurons? 2 or 3. What kind of charge does a resting neuron have? Has a slight positive charge on the exterior. Mechanoreceptor. The sense of hearing can be classified as this. Photoreceptor. The sense of sight can be classified as this. What do the free nerve endings in the skin respond to? Pain. Sclera. The white part of the eye. Conjunctiva. Is a mucous membrane covering part of the eye. Iris. The colored part of the eye. What does the respiratory mucosa line? Most of the air distribution tubes. The mucous blanket. Traps dust, pollen, and other contaminants. Serosa. The outermost layer of the digestive tract. Parotid gland. Is the largest of the salivary glands. Where does fat digestion begin? Small intestine. What vitamin can be stored by the liver? Vitamin A. Thermoregulation. Is function of the hypothalamus. What vitamin plays an important role in detecting light in the cells of the retina? Vitamin A. Cortex of the kidney. Outer part of the kidney. Medulla of the kidney. Inner part of the kidney. Intracellular fluid. The fluid inside the cell. What is included in the extracellular fluid? Plasma and interstitial fluid. Metabolism tends to add what to blood? More acids than bases. What does strong acids tend to do to pH levels? Greatly lower. Sperm cells develop where? Seminiferous tubules. Where does fertilization normally occur? Oviduct. Zygote. A fertilized egg. Stage 1. Longest stage of labor. Cystitis. An inflammation of the urinary bladder. Scopy. Means the process of visual examination. What is the suffix in gastroscopy? Scopy. Osteoarthritis. Means inflammation of bone and joint. Neuralgia. Means nerve pain. What is the suffix in gastrotomy? Otomy. Otomy. Means the process of cutting into. Pericardium. The fibrous tissue or structure surrounding the heart. Suffix. When analyzing the meaning of a medical term, you should read this first. Epithelio. The combining form for skin or surface tissue. Anterior. The combining form for front. Where is the liver found? Abdominal cavity. Where are the lungs found? Thoracic cavity. Plasty. Means surgical repair. What is the suffix in phleboplasty? Plasty. What is the prefix in malignant? Mal. Mal. Means bad. What is the prefix in postmortem? Post. The incentive to Medicare participating providers is what? Direct payment on all claims, a 5% higher fee schedule, faster processing. Medicare Part C is also known as Medicare Advantage. Goals of the physician payment reform: decrease Medicare expenditures, assure quality health care at a reasonable cost, redistribute physician payment more equitably. CMS handles the daily operation of the Medicare program through what? The use of Medicare administrative contractors. What is Medicare administrative contractors formerly known as? Fiscal intermediaries. What major change took place in Medicare in 1989? The Omnibus Budget Reconciliation Act. What edition of the Federal Register would hospital facilities be especially interested in? October. How often are outpatient dialysis services are usually reported? Monthly. What does HIPAA stand for? Health Insurance Portability and Accountability Act. When was HIPAA formed? 1996. What was the first uniform standard for patient privacy? HIPAA. What is HIPAA? Protection of privacy, security of patient information. What does HIPAA safeguard against? Fraud and abuse. What does ARIS stand for? American Recovery and Reinvestment Act. When was ARA formed? 2009. Implied consent. Patient voluntarily undergoes treatment, understands consequences, signatures are not required. Category I codes. Services and procedures widely used by many healthcare professionals in clinical practice in multiple locations and have been approved by the FDA. Category II codes. Supplemental codes used for performance measurements. Category III codes. Temporary codes for emerging technology, services and procedures. American Medical Association. Published and updated annually. Standalone codes. Contain the full description of the procedure for the code. Indented codes. Codes listed under associated standalone codes. Add-on codes. Used for procedures that is always performed during the same operative session as another surgery in addition to the primary service procedure and is never performed separately. Modifiers. Provide the means by reporting physician can indicate that a service or procedure that has been performed has been altered by some specific circumstance. Triangle. Represents a change in the code description since the last edition. Two triangular symbols. Represent changes in the text or definition. Bullet. Represents a new procedure or service code added since a previous edition of the manual. Plus sign. Indicated add-on codes. How many sections are there in the CPT manual? 8. Define a claim. Is a complete record of all services provided to the patient. The primary insurance plan does what in regards to payment? Pays first. What is an NPI number? Is a unique 10-digit identification number issued to healthcare providers in the United States by the Centers for Medicare and Medicaid Services. Where is the NPI number located on the CMS 1500 form? Block 17B. An aging report refers to what? The claims that are outstanding. Define allowable charge. Amount the health insurance company will pay providers. Are patients expected to pay the difference between a provider's charges and what the insurance company will pay? No. What does auditing refer to? Reviewing claims for accuracy and completeness. What is upcoding? Assigning a code that will deliberately result in a higher payment. Block 12 on the CMS 1500 form. By signing, the patient is authorizing the release of medical information needed to process a claim. Medicare is the federal health insurance program for people who are 65 or older, certain younger people with disabilities, and people with end-stage renal disease. Medicaid is a jointly funded federal-state health insurance program for low-income and needy people. It covers children, the aged, blind, and/or disabled, and other people who are eligible to receive federally assisted income maintenance payments. Define pre-authorization. A health plan gives approval for an inpatient hospital stay or a surgical procedure. Define deductible. The amount the patient must pay before the insurance company will start to provide benefits. Character 1 of ICD-10 PCS for medical or surgical procedure. Identifies the site. Character 2 of ICD-10 PCS for medical or surgical procedure. Identifies the body system. Character 3 of ICD-10 PCS for medical or surgical procedure. Identifies the root operation. Character 4 of ICD-10 PCS for medical or surgical procedure. Identifies the body part. CPT codes are used to describe services rendered by the provider. EM. Evaluation and Management. FDA. Food and Drug Administration. CMS 1500 form. The standard paper claim form to bill Medicare fee-for-service contractors when a paper claim is allowed. Whistleblowers. Informants who report physicians suspected of defrauding the federal government. Medicare Part C is also known as what? Medicare Advantage. Define infusion. Describes the pushing of liquid into the body over a long period of time. True or false? ICD 10 cm codes are alphanumeric with all codes beginning with a number. False. True or false? The letter X is assigned as a fifth character placeholder for certain 6-character codes. True. NCHS stands for what? National Center for Health Statistics. NCHS is the organization responsible for the development of ICD 10 cm. What is the maximum number of characters in an ICD 10 cm code? 7. True or false? Z codes can be used in the outpatient setting. True. True or false? Assign Z1.89 encounter for other specified special examinations for encounters for routine laboratory radiology testing in the absence of any signs, symptoms, or associated diagnoses. True. True or false? Assign codes as directed in the index only after verifying the code in the tabular. True. What is the dual coding theory? Is a theory of cognition according to which humans process and represent verbal and non-verbal information in separate related systems. True or false? If the type of diabetes mellitus is not documented in the medical record, you can code. False. You use the default is type 2 diabetes mellitus. True or false? A code from subcategory R65.2 severe sepsis should not be assigned unless severe sepsis or an associated acute organ dysfunction is documented. True. Chapter 11 Disease of the Digestive System contains what? Many combination codes that require careful reading. Chapter 13 contains codes for what? For bone, joint, and muscle conditions that are recurrent or chronic. Chapter 19 contains codes for what? Current injuries. Chapter 16 are what codes? The perinatal codes. Define the procedure service descriptor. Are the words that follow a code number in the CPT manual. Level 2 national modifiers are located where? In the introduction section of the HCPCS and also in Appendix A of CPT. K codes are used to identify the use of durable medical equipment. G codes are used to identify professional procedures and services that would otherwise be reported with a CPT code but no CPT code has been established. True or false, modifier may affect healthcare premiums. False, modifiers may affect the way payment is made by third-party payer. Modifier -57. Decision for surgery is used on EM. Modifier -79. Unrelated procedure or service by the same physician or other qualified healthcare professional during the post-operative period is used on surgery. Modifier -51. Multiple procedure is used on surgery. Modifier -80. Assistant surgeon is used when a second surgeon provides assistance to the primary surgeon. Modifier -32. Is used to indicate a service is mandated. Example, an insurance company requires a second opinion prior to surgery. The level of EM service is based on what? Documentation, key components, contributing factors. What are various types of anesthesia? General, regional, local sedation. True or false, the usual global surgery period for a major procedure is 60 days. False, it's 90 days. Parenthetical phrases that sometimes follow a code or code group provide what? Further information about codes that may be applicable. What two items are needed to correctly code for local treatment of burns? Percentage of body surface and depth of burn. Incision and drainage codes are divided into subcategories according to what? Condition for which the procedure is performed. True or false, codes for arthrodesis include the bone graft and instrumentation, and these can be coded separately. True. When coding a change of battery in a pacemaker, how do you code? Both the removal and the reimplantation are coded. What are the sections of the CPT manual that you use to code many cardiovascular services? Surgery, radiology, medicine. How many categories are located in the mediastinum subheading? 4. Third-party payers. Private insurance companies, Medicare, Medicaid. Documentation. Is the record of clinical observations and care a patient receives at a healthcare facility. 99,201 to 99,499. Evaluation and management. 0100-01999, 99,100 to 99,140. Anesthesia. 10,021 to 69,990. Surgery. 77,010 to 79,999. Radiology, 80,048 to 89,356. Pathology and laboratory, 90,281 to 99,199, 99,500 to 99,602. Medicine. Key components of EM. History, physical examination, medical decision. Abuse. Practices that directly or indirectly result in unnecessary costs to the Medicare program. Add-on codes. Used for procedures that is always performed during the same operative session as another surgery in addition to the primary service procedure and is never performed separately.